This video demonstrates how to use the Ceylon power system for bipolar radiofrequency ablation of benign thyroid nodules. You can perform the radiofrequency ablation on an outpatient basis. The thyroid nodule of the patient was examined beforehand and malignancy could be excluded. The patient lies down comfortably on a treatment table with the neck extended slightly. Before treatment, the location of the thyroid nodule is confirmed with the aid of sonography. The dimensions of the nodule are measured in transismic view in order to choose a suitable applicator for the treatment. Now you set up the Ceylon power system. First, turn on the Ceylon power generator. If you use an internally cooled Ceylon ProSurge applicator, you need to attach the cooling system. Insert the pump tube of the applicator into the pump and connect the tubing. You can now connect the applicator to the generator and set the desired power level. The power level depends on the chosen applicator type. A power setting of 25 watts is chosen for the procedure performed with a Ceylon ProSurge T20 applicator. Switch on the pump for a short time in order to pre-fill the tubes with saline solution. After completing the setup of the Ceylon power system, you can prep the patient. It is important to provide an extensive amount of disinfection to the patient's skin to avoid infections. Under ultrasound guidance, local anesthesia is superficially injected in the skin. Anesthesia of the thyroid or the thyroid nodule is generally not necessary. It might also be advisable to administer an analgesic to your patient. You can use a scalpel to make a 2 mm incision in the skin to ease the insertion of the Ceylon ProSurge applicator. For the insertion of the applicator, sterile conditions are mandatory. Under ultrasound guidance, the applicator is now inserted from the contralateral side through the isthmus of the thyroid into the nodule. By applying the transismic approach, vulnerable structures can be displayed and avoided. Therefore, a safety margin next to the so-called danger triangle containing the recurrent laryngeal nerve between trachea and thyroid should be created. Also, you should provide a safety margin to vulnerable structures like the carotid artery, the jugular vein, and the vagus nerve. By inserting the applicator in the transismic approach, the entire length of the electrode can be visualized via ultrasound. The insulator between the two electrodes at the tip is clearly visible and can be centrally positioned inside the nodule. After having positioned the applicator, switch on the pump and activate the RF power by pressing the foot switch. The status of the coagulation is monitored by sonographic imaging. The image shows an upcoming hyperechogenic cloud, which can be identified as an indicator of vaporization. When the power output slightly decreases, you can stop the energy application by releasing the foot switch. The first part of the thyroid nodule is ablated. In the following step, the position of the applicator is slightly changed and the ablation is started again. By repositioning the applicator next to the prior ablation area, you can create overlapping ablation volumes. With only a few repositionings, most of the nodule volume is treated. This approach is called multiple overlapping shot technique, abbreviated MOST, or MOST. This step is repeated until the whole nodule is treated completely. An indicator for complete treatment is total coverage of the entire nodule by the hyperechogenic cloud. Also, a decrease of the effective power can serve as an indicator for the end of the procedure. After the ablation procedure is completed, the applicator can be easily removed by pulling it out gently. The insertion site just needs to be cleaned with a swab. The Ceylon powered generator and the pump can be switched off. You disconnect the applicator from the generator and the pump. The single-use applicator is then disposed. Following the procedure, the patient should help protect the wound. Advise your patient not to take showers over the next couple of days. Furthermore, overstretching the neck as well as heavy physical work should be avoided. Immediately after the treatment, the patient will hardly notice any difference. Schedule a follow-up appointment with your patient after 3 months to control the effect of the bipolar radiofrequency ablation of the thyroid nodule. The puncture site only needs to be covered with a Band-Aid. After several weeks, your patient can expect a visible reduction in volume as a result of the body's resorption of the coagulated tissue.